So it's 6:30, the day of the trip, and I'm really sleepy because at about 4 o'clock this morning, I woke up and felt really constricted. And so I propped up with an extra pillow, and by the time I went back to sleep, the alarm went off. It's gonna be a long day. Hey, it's me, Jen, again, and I know it's been a really long time since I've put any videos out because, let's face it, life lately has not been normal. It's been downright weird. I'm a stay-at-home mom, and my kids are here, my husband's here, so opportunities for me to get away and lock the door and make a video have been few and far between. But I just wanted to make a short update video and let you all know it has been actually more than 3 months since my last RFA procedure, and on this day that I'm recording this video, it has actually been 1 year since my very first RFA procedure done at UVA Hospital. And I have nothing but good things to say about my results. My thyroid nodule has decreased in size from around 65 to 75 milliliters in volume down to 15 milliliters in volume. That is a significant decrease. That's about 70% decrease in size. As you can see, my neck looks way better. I'm absolutely thrilled with the progress that I've made. And the awesome news is that it's only going to continue to shrink. My doctor said when we talked a few weeks ago that the goal of treatment has actually been achieved for me. So now all that remains is just to continue to monitor every few months and see how I'm doing. And at some point I might have a third procedure, but right now that's not a definite thing. So I'm really, really excited about that. Let's talk about symptoms. So before I had my procedure last summer, I had a huge problem. Every time I would eat, I would choke. I would frequently have to stop in the middle of taking a bite and just kind of focus on, okay, I can swallow this, I can swallow this. And sometimes food would get stuck in my throat, and it was just absolutely terrifying. I also had a really difficult time breathing when I would lay down at night. I had to lay on my right side because my trachea was deviated to the right, and if I would lay on my left side, I couldn't breathe. I also could not breathe if I lifted my arms up over my head. That's called Pemberton's sign. If you have that problem, you might want to go see your doctor. So all of those symptoms decreased following my second procedure. But if you've seen other videos I've put out, I talked about how about 8 months after my first procedure, some of those symptoms started to return. And that was because I had a large portion that was down below this collarbone area that he was not able to treat in that first treatment. And that's what he addressed in the second treatment that I had in March. So I, again, had the procedure done in March, and all of that area that had moved upward was treated, and all of those symptoms that had returned in a much milder form are now gone. So I'm just so thrilled about that. I just can't say enough good things. Breathing, swallowing, eating, those are things that, you know, we all take for granted until they're gone, or until they become very difficult. And I'm so very, very thankful to be able to do those things again and to not think about them, to just live my life in a normal way. And if you recall from my video about my procedures in March, I actually had 2 procedures on that day when I went to UVA in March. I had a kidney procedure also. I had a very large cyst on my kidney. It was about the size of a baseball. And I had that kidney cyst treated with sclerotherapy, which is another term for what we talk about in our Facebook group called PEI. It's basically injecting ethanol into a cyst so that it will kill the lining of that cyst so that it will not continue to fill up with fluid. And I had this done on the cyst, and at the 3-month mark, I had a follow-up ultrasound, and that cyst is completely gone. My doctor and I both did not expect this. We were expecting it to shrink a significant amount, but we were not expecting it to completely disappear. So needless to say, that was a very unexpected and fantastic result. Having that cyst gone is just such a relief because it was huge. It was putting pressure on all my internal organs and it was causing some pain in my side. And so just knowing that it's gone and not having to worry about it anymore is fantastic. I'm very thankful for that too. So if you are someone who is dealing with thyroid nodules, I encourage you to take a look at other videos on this channel. There's plenty of resources there, but if you need more resources, please check out our Facebook group, Thyroid RFA and PEI Testimonials. And in that group, I have a section in the file section where we have a list of doctors who perform these procedures. That list is growing all the time. Even right now, during this crazy time, a lot of doctors are getting trained and they're wanting to offer these procedures to their patients. So please take a look at that. It's RFA and PEI Testimonials. The link will be in the description below. And don't hesitate to share that group or this channel with people you know who might be struggling with this, because when I first started this journey, I had nothing to turn to but medical journals. And y'all, those are hard for people that don't have a background in medicine to read. I have no background in medicine. I did a lot of Google searching on words because I needed to know what they meant and I wanted to understand what they were saying. But because that was so hard for me and it was so difficult for me to get the information I needed, I wanted to make this easier for anyone who's going through this struggle, because I know a lot of people don't want to have their thyroid removed. And if you don't want to have your thyroid removed, then I highly encourage you to take a look into these procedures. If you've got thyroid nodules or thyroid cysts that are benign, there is an alternative for surgery. Thanks so much for watching. If you want to learn more, take a look at these videos here to learn more about these procedures or to learn about my experience with RFA. And don't forget to subscribe, like this video, and share it with people you know that it might be helpful to. And never ever forget to educate yourself and always be your own health advocate.